Sister Peter Claver, it's pretty hard to find somebody in the last 100 years that probably represents better the mission of the Sisters of Providence.
She was there to serve, and that meant on all levels. So it didn't matter if you came in with nothing, your quality of care was the same as everybody else's.
So if you go back to the history of the Sisters of Providence, the Sisters of Providence have incredible vision as far as what we need to put in place to help safeguard the continued vulnerability that's there inherently in society, and making sure that we're always there as a net for those that are marginalized in our community. And I think the Regional Health District and the work that they're doing under the leadership of Dr. Lutz aligns with that vision. How do we identify the poor and vulnerable? How do we put systems in place, one, to strike down injustice, making sure that we're driving to equity and equality, and two, how do we make sure that we continue to serve in adversity and being really innovative in the sign of unforeseen challenges, including a pandemic.
Especially in this time, we have all of us been overwhelmed. And yet every time I saw Bob, every time I saw Amelia, every time I saw Lindy, every time I saw Jennifer, every time I saw Natalie Townsend, anybody on the district, is that they were on it and knew that we got to keep going. It's amazing. And I'm beyond thankful for what they've been able to do for us.
Bob, I think, is an individual who has the ability to work with people to help them understand. He's a person that has a lot of compassion for individuals. And I think it's hard sometimes for people to see that when he has to be so matter of fact about the science and what is going on.
He's made himself available to the community, both in a public eye, but also in sitting down, at tables and getting on Zoom calls and making himself available to have really difficult conversations. I don't know that any of us can appreciate both the pressures and often you're always going to have dissatisfied folks no matter what part of this issue he's having to handle, and he continues to be present.
One message I would share with Dr. Lutz in the Health District, and it's something I have on my own wall at my office, is a quote from Dr. King: "The ultimate measure of a man or a woman or an organization is not where they stand in times of comfort and convenience, but where they stand in time of challenge and controversy." You gotta be in the moment, but you gotta lead. And that's what Sister did, and that's what Dr. Lutz in the Health District is doing. Those are some of the most important qualities I think they share.